Disclaimer slide, this is a student presentation using a hypothetical scenario. All right, hello everyone, my name is Alexis Clauser, and I'm an environmental health specialist with the Arkansas Department of Health. Today in our presentation, we will be discussing the importance of pediatric vaccination. Thank you so much for joining me, and I'll take questions at the end. So now we are going to give a little history of vaccines. So there are many types of vaccines, and looking back at the history, one of the earliest vaccines that we have on record is the smallpox vaccine. And we do know that there was experiments and science being done around vaccination before this time, but smallpox is one of the first on records. And then we have the creation of the MMR, measles, mumps, and rubella vaccine in 1791. Again, this is just a very brief jump through history, so I'll just mention a few of the high points. And I'm sure that most of you are familiar with MMR, measles, mumps, and rubella vaccine. And polio is eradicated through vaccination in 6 years, from 1988 to 1994. So this was a big moment, or big 6 years in vaccine history, because this was a very successful vaccine and it ended up eradicating the polio disease, which is a huge deal. So to talk about the importance of vaccines, vaccines are important for several reasons, and we are going to speak about those reasons today during today's presentation. So vaccines help to control the spread of disease. They also help further antimicrobial resistance. So the more vaccinated our population gets, the more resistant that we will be. And then in terms of pediatric vaccination, really one of the most important parts of vaccination is that it helps to limit the number of children who might get deathly ill. So children are in school, or they're in daycare, they're at parks, they're at places that are really crowded and have a lot of other individuals, especially those who are just getting out for the first time and exploring the world. So vaccines are really important because it is possible for these kids, while they're out and about, to contract a deadly illness. And if they're not vaccinated, then that can have major health implications for the children. So again, there are many different kinds of vaccines, and you'll see on a slide later in the presentation, which I believe it's the next slide, that the CDC has come up with a list and a schedule for vaccinating children. So the CDC is the gold standard when it comes to vaccine safety and vaccine efficacy. So the recommended pediatric vaccination schedule, and I just wanted to put this in the presentation early on, just so that you all in the audience know that this is available to you on the CDC website. So the CDC, as I mentioned before, is the gold standard when it comes to testing and promoting safe and effective vaccines. So this schedule is available for download, and you can actually view the schedule by age or by medical condition, depending on which schedule makes the most sense for you and your family. And so this is a great resource that you can go out there and download and use this to know when you need to schedule your children's vaccines. Okay, so this is again a high-level overview, just a few points here about vaccines. So vaccines are safe, they are effective, they are necessary, again, especially for children, like we discussed in the first slide. They can save lives. Vaccines are improving. We're constantly doing experiments in science surrounding making vaccines even better or to have a higher efficacy rate. And they're life-saving. So according to the Mayo Clinic, vaccines save about 285 deaths an hour. So this is really important. Vaccines have eradicated disease in the past, and we're hopeful that they will continue to do so, especially as we improve our rates of vaccination. So let's discuss vaccine efficacy. I have here a graph of vaccines for strep. So on the left, we see our cases per 100,000 members of the population, and at the bottom, we see our year. So this is basically looking at a couple different types of vaccines for strep. So PCV7 is the first type of vaccine for strep that we will look at. And so pre-implementation of this vaccine, the numbers for cases per 100,000 were very high, up in the mid-80s and almost approaching 90. So what we see here is after the introduction and implementation of PCV7, which again is a type of strep vaccine, we see those cases drop exponentially. Just there's a huge drop there after implementation, and it's remained steadily at zero or near zero since then. We also see our PCV13, which is a different type of vaccine. So we see kind of a similar situation. Cases were growing, and that black line shows when PCV13 was introduced. So we see not near as much of a spike as we start off with before PCV7, but we do see a bit of a gradual incline among cases. And after that implementation of PCV13, again, the number drops off within a year, or within 2 years, the number levels out at 0 cases. And this shows how effective vaccines can be. There's lots of graphs like this on the CDC website, and you can easily see after the implementation of a vaccine what difference it makes in the number of cases. So this is a very interesting slide that I just added in here just to talk more about efficacy. So what does efficacy mean? This figure is from the World Health Organization. So we see here it says if a vaccine has an efficacy of 80%, that does not mean that the vaccine will work only 80% of the time. What efficacy percentage means that in a vaccinated population, 80% fewer people will contract the disease when they come in contact with the virus. So if you're looking at a fully vaccinated population, 80% fewer of them will end up infected with the virus or with the disease due to vaccination. So you're not talking about, the percentage of time that a vaccine is effective. So this is what efficacy is in terms of vaccination. So far in this presentation, we have discussed how vaccines are safe and effective. We've talked about how vaccines save lives. We've talked about the history of vaccination very briefly. So talking about vaccines that were available and effective back in the 1700s. So vaccines have had a long history. And again, we have shown a graph that shows how effective they are at reducing, instances of a disease. And we've also talked about what efficacy is in terms of vaccinations. So that leaves us with addressing concerns and misinformation. So unfortunately, surrounding the topic of vaccination, misinformation and disinformation is something that we see a lot. So, and this can be really dangerous because what misinformation and disinformation can cause us to do is it can cause people to reevaluate whether getting vaccinated is something that they want to do. And so it is important to address this misinformation and also these concerns with vaccination, especially for kids, so that our kids can be safe and healthy and they can avoid contracting diseases that might be deadly for them. So one of the more well-known controversies surrounding vaccinations would be the correlation or the alleged correlation between vaccines and autism. So there was a doctor whose license was later revoked, Dr. Wakefield, and there was a dangerous case series surrounding, this correlation, or alleged correlation between vaccines and autism. So Dr. Wakefield's license was later revoked, but the damage had been done from something like that. Sometimes it's hard to combat that misinformation. So in 1999, the American Academy of Pediatrics published a 21-page paper with extensive evidence on the safety of vaccines. So in this paper, they basically used science to prove how safe and effective vaccines were, and they did disprove this theory of this alleged correlation between vaccines and autism. Now again, that was still in some ways damaging to the idea of vaccinating children, because that is a very scary concern. But again, the American Academy of Pediatrics did conduct several experiments, and they also did extensive research into vaccinations to disprove this original theory. So again, vaccine effectiveness. So effectiveness, this is kind of like the graphic that we showed on an earlier slide. So effectiveness measures how well the vaccine improves the health of communities as a whole. So the higher percentage of vaccinated people within a community, the more likely that that community is to develop immunity from a certain disease or virus. And vaccines approved by the FDA are safe and effective. So today we've discussed some concerns and misinformation. We've discussed vaccine efficacy and what that means, and we've shown how effective vaccines and safe vaccines are. So this leaves you as the audience with some places for action. So I'll leave you today with a couple action points that you can implement. So one of them is to go onto the CDC's website and to continue that education that we've talked about today. So reading more about vaccine efficacy, or even reading more about specific vaccines and the science behind what makes them effective and why they work. Definitely going onto the CDC's website and looking at and downloading your very own copy of the pediatric vaccination schedule is a great action point, as this will keep you informed and up to date on your children's vaccinations. You can also continue to read more about vaccines, and you can encourage your community, other people in your life, to also vaccinate their children, and educate yourself on the public health implications of vaccination. So kind of like we talked about at the beginning of the presentation, how vaccinating kids can keep them from developing severely dangerous injuries and again spreading those to other people within their population. So that does conclude my presentation. I would like to thank all of you for listening to today's presentation, and I do have a few references that I've listed here. I've really enjoyed having the chance to talk to you all, and I'm hopeful that I can come back and speak about this topic or about another topic sometime in the future. Thank you.